Hello, my name is Cindy Trawick, and I'm going to do an educational demonstration for you. I'm going to demonstrate to you the application of the traction splint. The purpose of the traction splint is to mobilize upper thigh injuries that do not involve pelvic injuries, knee injury, acute above the knee injury, directly below the knee, any injury to the lower leg or to the ankle. We have done a head-to-toe assessment of our patient, and our patient has none of these injuries. But he does complain of pain to this right thigh area. So we're going to initially put on our gloves to continue our assessment with our patient, the application of the splint. We're going to cut off the pants leg and expose the area of complaint. And we note that there is swelling and bruising of this area. So I'm going to ask my partner if she would please apply manual immobilization of the foot, of the leg, while I go ahead and assess the rest of the area. Sir, I'm going to remove your shoe, okay?
All right.
I'm going to try to be real careful and not move your legs. I know it's painful. I'm also going to remove your sock. I'm going to check for a pulse. You have a good heel pulse. Can you feel me touching your foot?
I can.
Excellent. Can you move your toes? I also would like to compare what I'm assessing here with your other foot, okay? So I'm going to remove your shoe and sock over here. Pulses are equal. Can you move these toes? Excellent. Okay. So I'm going to apply an ankle hitch on our patient. This is in order for us to apply traction with our splint. We don't have one that's commercial with the splint, so I'm just going to make one. With two cravats, I'm going to cross them. I'm going to go under the ankle with two of the cravats, leaving a loop on each side, and trying not to move the patient's leg and cause any further pain. I'm going to cross it over on each side. And then I'm going to tighten it. Are you doing okay, sir?
I know.
Excellent. At this point, I'm just going to tie it here and secure it. Can you still feel me touching your foot? Does that feel too tight?
No, it's fine. Thank you.
Excellent. Okay, at this point, I'm going to go ahead and apply manual traction on my patient, and I'm going to provide an area for my partner to attach the hitch. Okay. Sir, I'm going to be pulling on your leg and elevating it so that she can put the splint on your leg, okay? So I'm applying traction and elevation. Are you doing okay, sir? Do you feel any relief or pain with that? The end of this traction splint is going to go right up under the bone contact with the buttock. It's going to pad the groin area to decrease any discomfort as she applies the ischial strap. Ischial strap should be secured, snug, not too tight, but allow still 2 fingers up under the strap. At this point, she's going to apply the hitch. And then she's going to meet my traction. Do you feel that, sir? Do you feel some relief of discomfort?
Yes. I do.
Excellent. And so at this point, I'm going to let go here and go ahead and support the foot and the splint while my partner goes ahead and applies the straps. She's going to do one at the ankle a strap just above the injury. Just below the injury and above the knee. And just below the knee. We're going to reassess our ischial strap and make certain that it hasn't slipped or become loose. She's going to continue to hold this until we can get him on a backboard. I'm going to reassess his circulation, motor function, and sensory. Still have a good pedal pulse. Do you have movement, sir?
Yes,
Can you feel me touching your toes?
I can.
Okay. Because our bed is too short, we're going to keep our brace up and put him on a long backboard, secure him to the backboard, and then secure the splint to the backboard to decrease any further movement. And then we're going to prepare him for transport to the hospital.